All right. Thank you, Mitch. Danny, do you have any questions?
Yes, this is for anyone who can answer this. Uh, One of our followers contacted me and wanted to know, you know, is there any danger? They've been finding gloves being discarded in the parking lot of a grocery store. Does that cause any health risk to anyone that is coming in and out of the grocery store?
Well, any bio anything that has gone through the body is essentially a health risk, and in that regard, the idea would be whoever is going to come near that or clean after that has to take all the necessary precautions so that that person doesn't get exposed. Now, of course, if anybody were to just bend and pick that up, they're at risk to themselves. However, you don't know what that glove has been or where that glove has been. And the prudent thing is to always take the necessary precautions as not to pick up any bio hazard material that don't know. And those who work in that field are properly trained as to how to collect and dispose, bio effect materials.
So what should a person do if they find a bunch of gloves out in the parking lot? Should they contact the management of that store?
The best thing would be that to contact the management, and of course the management, I'm assuming that management has been trained, because they do house housekeeping and environmental folks who work in their organization who have been trained. That is, even if the manager has not been trained, but those type of house staff can, help in that situation. Secondly, if it's a biohazard, then the appropriate authorities have to be called without anybody touching it. The idea will be to cordon it off and not allow anybody or allow it to spread.
Okay, thank you.
All right, Danny, you good?
Yes, I'm good.
All right, Marcos, do you have anything? All right, Marcos, what about channel 2? Are you guys there? All right, I do have a couple questions from Shelby. I do have a couple questions from Shelby from channel 7. First question was, these are coming from viewers. Do both hospitals have the hydroxychloroquine, and are they using it on COVID patients? I don't know if I pronounced that correctly. I know what she was talking about, but are both hospitals, either hospital, using that on COVID patients right now?
Medical center is using the hydroxychloroquines, yes.
Yes, and so is Ormc. It's the only treatment that has been around for long enough in this disease process to show that there could be potential improvement. Although there is no proven treatments for COVID, that's the one drug that has been around the longest. So we are using it for the COVID positive patients, especially the ones at moderate and severe risk.
And I guess the follow-up question would be, there's no further clinical trials of that. Is it seem to be working? Is it at least holding the patient steady?
There have been a ton of clinical trials, none of them published yet. So we're hoping that data does come out. Anecdotal evidence is what we have so far from the front lines, and those have been shown to be helpful, although not consistently. So we are using it for moderate to severe risk patients, and we have seen some improve, and we've seen some, as you saw, that aren't doing well even with that drug.
Okay, awesome. Thank you, Dr. Saravan. I got a couple more questions. Viewers asking, did ORMC and MCH ever talk about just having one hospital be the COVID hospital and all of the other hospital just handling all of their patients?
Stacy and I, we did talk about that. Unfortunately, this situation moved so quickly. I don't think that we had appropriate time to be able to get that going. the patients and the testing just ramped up so fast that once we started putting our heads around that, we didn't think that we could make that happen and keep everybody safe. And safety was our biggest concern, not exposing people where they didn't need to be exposed. And we felt like the setup we had was pretty sufficient. Stacy, anything you want to add to that?
No, I think you did a great job with that response, Leslie.
Yeah, and if I can add one more thing, I would just say that transport of a COVID positive patient in and of itself increases risk of exposure. So if there is a opportunity to care for that COVID patient with the least number of touch points, we would always go for that. So if they showed up here first, or if they show up in Andrews first, and we can provide the care there at the level that they require, it is better not to avoid exposure.
Okay, and then the last question I had was, oh, sorry, did you want to say something, Stacy?
No, it was Kristen. I was
Oh,
just
Kristen,
going to tell you one that we did have the opportunity to work on because we hadn't seen an influx of pediatric patient was to partner with the ORMC to allow them to have the ability for beds to take care of their COVIDs and put the pediatric patients here at Medical Center. So we did get to do some of that pre-planning, just not in all patient aspects.
All right, thank you, Kristen. The last question we had from the public, we've seen a lot of these reports about disaster declarations and funds possibly being distributed to local hospitals. Have the hospitals, any of our local hospitals, received federal funds? If so, how much, and how does it relate to the daily budgets and things like that?
I'll go first. We did receive some funds over the weekend. I know our partners over at Midland Memorial reported theirs. Medical Center did receive just a little over $5 million in funding. And that sounds like a big chunk of money, and it is, except if you compare our revenue decline over a shorter period of time, we had lost about $7 million in revenue over that same period of time. So we'll take anything we can get. I know it's all based on our Medicare cost report from prior years, which is a big long formula that we all fill out. But when you hear that number, that $5 million was received, that's a great number. But on the same time, our revenue loss over that same period was about $7 million in that. So still upside down, and that's just for a very short period of time that we received that money.
Yes, and I would say in terms of Odessa Regional, very similar situation. We received about $650,000, so much less based on our percentage of Medicare, so that's why it's so different between the two hospitals. One thing that I understand about that, however, is that's an advance on future Medicare payments that we would earn later in the summer, provided that business at some point gets back to normal. So it's not like that. While it helps, it's not like that's income that we're not going to earn eventually. It's not additional funds to help us really deal with the crisis that doesn't have to be repaid, in other words. So, and like Russell said, it's also a very small percentage of our operating budget, but every penny helps, and we're very grateful to have it today.
Yeah, we're very thankful to the President Trump and his work that he did to get that bill through and to make sure that both sides of the aisle were able to sign off on that. And I guess all we can say is send more. We'll take it.
That was the last one I had. Anybody else have any other follow-up questions before we reconvene tomorrow at 3 o'clock?
Hey, Trevor, I got one question.
Okay.
Is there any concern with this past weekend's church cases, chicken cases?
Can you say, was that Marcos? We couldn't hear you.
Yeah. Is there a concern about people attending church services over the weekend and that causing an increase in cases possibly?
The question was, were there any concerns about, I guess, churches that held service here over the weekend, and if, we could see an increase in cases because of that?
Listen, I'm sorry.
Oh, he wondered, was there any concern? I guess some churches in town held church services over the weekend. Was there any concern from medical officials on, I guess, because it would be considered a mass gathering, any concerns about a potential spike or anything because of that?
I would, maybe Dr. The health authority, y'all want to,
Health department.
yeah.
In actual fact, yes, but it's too early to determine what the effect that will be. However, by the time we find out, it will be too late. So the whole idea of the preventive aspect of, social distancing and physical distancing is very important. So of course, what we'll start looking for is that if we, find cases and we start linking it to that type of gathering, then we will have to, take the necessary approach that we take in public health.